So again, I'm Adrian Jones. I lead our community health improvement work, and we can go to the next slide. And so during this presentation, of course, you will receive an overview of our UW Health Community Health Implementation Strategy, as well as a robust discussion and presentation on the ConnectRx Wisconsin program. Next slide. All right, so I think the best way to really explain what is community health improvement, it's really about being person-centered and centering the voices of the community members and those most impacted, and recognizing the importance of community being seen as the experts, and how we are to work in collaboration with community in order to really move the needle. And so part of the work around community health improvement includes developing a community health needs assessment. So we're engaging organizations across Dane County, as well as individual community members to garner input, as well as looking at what the data shows and seeing where's the alignment as far as understanding what are the inequities that exist in our county. From there, we are supposed to develop a comprehensive action plan to say, this is how we actually plan to address these health priorities. And including that also names that what collaborations we intend to do, what resources we will plan to use, and where we see where there's actually momentum happening already. And then, of course, our implementation piece. And in our implementation work, we're also making sure that we're being very intentional about continuing to engage community as we continue to move forward. Next slide. So if you're not familiar with what the health priorities are from our most recent community health needs assessment, we have reproductive justice. And I just want to name that as a health system, it is a pretty big deal for us to identify reproductive justice and use that framework as we look to improve health outcomes for Black and Brown birthing folks. And it's also important to call out that the reason for using this framework is making sure that we're being inclusive of all bodies that give birth, as well as thinking about how can we look at things from a life course perspective. And then we have chronic conditions, which falls with heart disease, hypertension, diabetes, our behavioral health work, mental health and substance use, and then our injury prevention, which is actually a newly added health priority, and that includes falls, accidents, and violence prevention. Next slide. So for our reproductive justice priority, our goal is to improve birth outcomes for Black birthing patients and their families, and recognizing the intergenerational impact on what it means to improve reproductive health outcomes for Black birthing patients and their parenting persons. Next slide. All right, so here's our health impact pyramid. Some of you may be familiar with that, especially if you've seen previous work presentations, but this is basically how we outline our strategy initiatives. And so here we're partnering with an organization called Each One Teach One, which is led by Tara Wilhelmy for our health promoter program. And that program basically encompasses hiring folks within the community to conduct or provide health education in kind of an informal way, if folks are familiar with kind of the health promoter model or the promotor de salud model as well. And so looking at delivering that education in our 6 high need zip codes. And then under trauma-informed care, making sure that we're able to really wrap around the whole patient, and to ensure that we are providing the most comprehensive, culturally sensitive care, and recognizing that when it comes to reproductive health or reproductive justice, is that there can be different things that trigger current or past trauma, as well as recognizing the impact of trauma for our providers and clinical staff. And then human lactation support. So here, specifically with our partnership, with our joint operating agreement with Meritor, that initiative on the hospital side for labor and delivery is making sure that all babies, specifically, especially Black babies, are receiving human milk born at 37 weeks or greater. So whether that means through donor milk, breastfeeding, chest feeding, co-lactation, just making sure we're providing that comprehensive lactation support in a very inclusive way. And then for postpartum care, one of the things that we've found is that rates for postpartum care completed visits are on the lower end for our Black and Latinx populations. And so here, improving access to postpartum care visits, whether that's through virtual care or in-person visits, and just looking at how we can best remove some of those barriers. And so when patients are able to call to schedule, making sure that schedulers are also offering the virtual care option as well. And then we have our community giving. So UW Health is unique in the sense where we provide unrestricted community giving to our community partners. And so that means just trusting folks of color to do the work that they're already doing and making sure that we are elevating their work and making sure that they are able to continue to propel that work forward as intended. And then diversifying the perinatal care team. And what you'll find out later with ConnectRx, especially with Ariel and Jawana, is that community health workers are actually a part of the perinatal care team. And then it also includes doula services as well. But again, that connection between recognizing the importance of addressing social needs and how that can impact maternal health. And then the screening and referral for social determinants of health, that is our ConnectRx work. Next slide. All right, so for chronic conditions, we're looking at how we can improve chronic conditions care for BIPOC communities across the life course. So really that's about one, addressing uncontrolled hypertension, diabetes, and heart disease, but also making sure that we're able to kind of create a space in which we establish patient self-efficacy. So patients are able to self-monitor their blood pressure and glucose levels at home, while also making sure they're connecting to their primary care doctor and having those preventative screenings. Next slide. So at the clinical level, we have our cardiovascular care program that we're looking at, and this is specific to diabetes and hypertension, and looking at how we can closely align and collaborate with community partners to, have early detection, or not early detection, but making sure that we're able to identify folks in the community who have uncontrolled diabetes and hypertension, and provide things like home blood pressure cuffs, potentially glucose home monitors, but then also making sure that there's still that connection back to primary care. And if you're a UW Health patient, making that connection to pharmacists in primary care. We have our pediatric fitness clinic and community partnership piece. Many of our families that we serve in the clinic are not always necessarily aware of the pediatric fitness clinic. And so the big piece around here is increasing referrals to that clinic, as well as any other barriers to access. We know that for public transportation, it's not the easiest clinic to get to. So seeing how we can build out that access and what that looks like going forward. For mammography breast cancer screening, this initiative is largely under our ACO, or Accountability Care Organization, which is ACO REACH. So we have a health equity plan under this initiative. And again, this is around improving early detection rates for breast cancer for our Black and Latinx population, and kind of being able to connect with community members to address any kind of misinformation or support patients in being able to schedule a mammogram and do that at a much earlier rate. We know that the pandemic has definitely shifted that work. And that it's increased the rates of late detection of more aggressive breast cancer. And then, of course, our social determinants of health work. And going back up to the top, we have our healthy habits. And this is our pediatric diabetes work that we are doing in collaboration with schools and other community organizations. Next slide. For adult behavior health, here, part of this is also including community collaborations, but overall our goal is to be more expansive in how we improve access to mental health services, and especially substance use disorder treatment. Next slide. I want to call it here that for our FY23, or our fiscal year 2023, we're really in a strategic planning year. And so what that means is really working closely, especially with our partners at Meritor, to really think about how we can best be intentional about providing robust, comprehensive behavioral health support and really addressing the needs that especially we've seen, I don't know if we say since coming out of the pandemic, but we definitely know that there's been an increased need for mental health support. We have our hub and spoke model, and that's improving access to addiction medicine. So reducing the turnaround time for being able to schedule an appointment, expanding access to behavioral health. This is around our integrated behavioral health. So integrating behavioral health in all of our adult primary care clinics. We have Expand Zero Suicide, and then providing culturally responsive care. And what that looks like is one, looking at how we can diversify our behavioral health workforce so that patients are seeing providers that look like them, but then also making sure that people are receiving education information that's reflective of the community we're serving. So looking at language, looking at marketing material, and so forth. Next slide. And for our pediatric behavioral health, we're wanting to expand behavioral and mental health support for children and adolescents and kind of see how we can move that even beyond clinic walls. Next slide. So just as with adult behavioral health, we are also in a strategic planning year for FY23. But I really want to call out some things here where we talk about school community partnerships. So that's around really increasing access to mental health support for children and adolescents in the schools. We are also, similar as we did with our adult behavioral health, is integrating behavioral health and pediatric primary care clinics. So again, having that, that expansion across the care continuum, youth community-based mental health support, again, working closely with organizations who provide youth programming and thinking about what does that look like to have more of a wraparound approach to supporting youth in that area. Next slide. So for our injury prevention, again, this is there's a newly added priority area for us. And really here, we're looking at what does it mean to reduce unintended and intended injury across the life course. Next slide. So for injury prevention, and I should have mentioned this before, but across our community health implementation strategy, we're addressing health outcomes with not just adult population, but pediatrics. So again, in reproductive justice, chronic conditions, and so forth. So here we have our trauma-informed culture collaborative, which is a group of stakeholders, mostly internally. We're looking at how can we best provide trauma-informed care support, both for staff at UW Health, but then also looking at what does that mean for making sure our providers are able to have training and education support to be able to provide the best services they can for our patients. We have the screening referrals for UW Kids Safety Center. A lot of families actually don't or aren't fully aware of all the different products you can have access to. For example, like specialty car seats, helmets and things like that. And so increasing those referrals, letting people know what they have access to, especially thinking about looking at our data where there are specific zip codes that we know are not having high utilization of the Kids Safety Center. And then we have screening referral for falls. So here, and I'm excited to actually announce that we will have a stepping on class starting at our East Terrace Clinic. I believe that start date is March 29th, I would like to say. And then adult peds and firearm prevention and prior injury screening. So here we're looking at how do we identify those who are most at risk firearm injury and thinking about those who have a history of it as well. And then child passenger safety community programming, looking at how we can, meet folks in the community where they're at to making sure that they have access to car seat checks, support with car seat installation. So that includes also working with community partners and potentially looking at those who would like to become trained to actually facilitate that. And then we have our gun violence prevention, community collaboration. One of the things that came out of, especially during the pandemic, is the increase in gun violence in Dane County, then of course we know nationwide, and making sure that not only can we work at collaboratively to prevent that at the community level, but also making sure we're able to keep our patients safe across all clinics and ED. And then we have our age-friendly primary care, strategic planning, and then again, screening for that social determinants of health and referrals. That includes referrals to community-based fall prevention programs, as well as making sure, especially our older adult population, 65 and up, have access to community resources and make it also so that it's easy to navigate. Next slide. And so I know there's a lot on this slide, but these are our key performance indicators for all the different health priority areas. The biggest thing I want people to walk away from with this is that we are being very intentional about tracking and monitoring progress. So we have a comprehensive dashboard that we have built to monitor and track all of these key performance indicators, but then also to be able to report back to our internal and external stakeholder groups to say this is where we're at. This is maybe potentially some of the challenges or barriers that we're seeing, and then thinking about how can we potentially recalibrate if we need to on how to improve some of these things. Next slide. This slide is really important. I'm sure many folks on this call are familiar with Dane dances. But part of the reason why I chose this picture is one, to me, this is what represents Dane County, or the idea of community when it comes to Dane County. It's, it's diverse, all different walks of life, abilities, race, ethnicities, and so forth. But it also speaks to, when we have this phrase up here, nothing about us without us, this speaks to our foundational principle. And that's around community engagement, steering the voices of the community, and recognizing that we can't do this work together. We have to work with community. But we also have to be making sure that we're being intentional about that work, and honoring and recognizing the expertise of the folks that we engage with. And again, so that is this piece right here. And I think I may have one more slide before transitioning. I may not be. Oh, okay. Well, I don't. Thank you. So I'll go ahead and pass it over to Ariel.
Thank you, Adrian. So I will start by just sort of outlining how I feel like Adrian does, she sort of builds up to how we got to where we are today. So ConnectRx Wisconsin is a program that falls under the larger Saving Our Babies initiative that's spearheaded by the Dane County Health Council and partner organizations that we work very closely in the space with, which are the Foundation for Black Women's Wellness, as well as Equity by Design. So it is, this program is a direct result of the CHNA and CHIS in action. So we are, all of the data compilation that is done and the analysis that it's done to help us determine what type of programming is going to be necessary to dispel the disparities that exist. So the Dane County Health Council is a multi-sector collaborative that's comprised of 4 major healthcare organizations: our local United Way, the local public health department, Madison Metropolitan School District, and then our consulting community partners, as well as the Black Maternal and Child Health Alliance. And we are all working together to eliminate gaps and barriers to optimal health and reduce disparities in health outcomes. In 2017, the Health Council adopted a shared goal of eliminating inequities in low birth weight and infant mortality for babies born to African American birthing people in Dane County as part of the shared community health needs assessment. In 2018, Wisconsin ranked worst in the nation for Black infant mortality, and unfortunately, very little progress has been made since then. Just a few statistics that I feel like really help sort of frame the issue, the problem issue. 9 of every 1,000 babies born to Black birthing people in Dane County don't live to see their first birthday. Babies born to Black birthing folks are 2 times more likely to be born low birth weight. ConnectRx Wisconsin is a direct response of these inequities and a potential solution to helping resolve them. Here's just a slide of the partner organizations that are involved in this deep work that's taking place. You'll see all of those healthcare organizations, along with the Foundation for Black Women's Wellness, Equity by Design, and the Black Maternal and Child Health Alliance of Dane County as well. As Adrian said, our collaborative is committed to the foundational principle of nothing about us without us, which is evidenced by the deep collaboration and the deep engagement that has taken place in order for us to get to where we are today. As Adrian also pointed out, that also includes once we do develop different programming and different solutions to meet to be able to dispel those disparities, that we take those solutions back to the community to verify that we've not only built something that's reflective of what they've previously shared, but that also is reflective of services that they actually would like to take part in and utilize themselves. So the Saving Our Babies, this is just the critical and consistent themes that were developed and uncovered during that deep community engagement. So I think it's of no surprise to anyone on this call that racism, discrimination, and institutional bias really rose to the top. So during the community engagement sessions, the Foundation for Black Women's Wellness and Equity by Design, they engaged over 300 Black families who shared that the root causes of the persistent inequities are chronic toxic stress over the life course, as well as a few other themes that surfaced, including those listed here. So primarily poor access to health supporting assets and disconnected and hard to navigate community resources. So we've leveraged the feedback that we gathered during the community health needs assessment cycle and the various stakeholder engagements, and ConnectRx is our solution that we're putting forth to take data and put it to action. The long-term goals of the program include, or the overall initiative, I should say, include eliminating the Black-white inequities in low birth weight, infant mortality, as well as the social determinants of health, including education and economic outcomes and opportunities. Our key strategies and activities include continuous Black family engagement and leadership, so continuing to center Black families as we continue to do this work in this space. We are utilizing a universal risk screening of social determinants of health across the partner organizations, as well as community resource coordination and navigation workflows. So this piece speaks to just the community resource directory that we are utilizing from one of our partner organizations, United Way of Dane County, as well as the changes that we had to make in the different workflows in order to accommodate a social determinant of health screening. We certainly wanted to make sure that if we're screening for social determinant of health needs, that we had appropriate supports in place when needs were identified. And then that closed loop referral system. So these are organizations that we have a deeper partnership with that we're able to utilize some bidirectional communication to be able to determine how quickly or whether or not organizations are able to support patients when they do have needs identified and we're sending over referrals to them for support. And then that workforce diversity. So the new maternity care team composition. So this includes the community health workers that we've added as care team members in this space, as well as the doula referrals that we're also sending as well. Our ConnectRx workforce consists of our community health workers who are frontline public health workers who are closer to the community. So they just tend to have more of that cultural competence as well as some lived experience to be able to help folks navigate some of these systems and resources better. And then our doulas as well, who are trained professionals who provide continuous physical, emotional, and informational support to birthing people before, during, and shortly after childbirth to help achieve the healthiest, most satisfying experience possible. And here I would just add that luckily, because of the way that we've designed the program, our doulas are actually able to stick with folks postpartum as well as a birthing doula. And so this helps us really be able to provide a really wraparound support to folks up to that 1 year of postpartum. And then our health promoters as well, who will be providing health education and promoting a healthy lifestyle to community members. Our ConnectRx Wisconsin strategy is a screen, link, refer model. So we are screening across healthcare organizations for social determinant of health needs. Super happy to report that this universal screening has resulted in over 3,000 OB patients being screened for social determinants of health since we went live in March 22nd of 2022. The next piece is our link component. This is where we are linking folks to the different community resources that are available. This is also where we would send a referral to those closed loop referral organizations if we have that bidirectional communication set up in the EPIC system. And then the care component, and this is where folks get that extra additional layers of support. So the community health workers are able to support those that are referred to the program and that see benefit in having an additional person on their care team to help navigate those non-medical needs. So really quickly, I just want to walk you guys through sort of from the patient perspective, what it looks like when you're referred to ConnectRx. So I think at this point, it wouldn't be too upfront or too promising to say that ConnectRx is truly changing the way that families like Danielle's experience health care and community service delivery. So when Danielle would arrive for her OB appointment, she will have received either already filled out that screen, that universal screening that I referred to earlier, or because we know that folks have different access to my chart. They may use it, they may not. We have a couple of different options for how they can complete this screening. So they, like I said, either get it in my chart, or when they arrive at their clinic appointment, they can fill it out either on an iPad, on a paper form, or if there is a health literacy issue, they also can have some support by a clinician to help fill this out as well. And so Danielle would fill out that screener. And if Danielle, if she screened positively for any one of these 5 social determinants of health needs, then a referral would be sent to our community health worker team. And that's where Jawana comes into play. So she would have to identify as Black or African American. She would have to have a positive pregnancy screening, as well as have a positive screening for one of these 5 social determinants of health needs. So that referral would be sent to Jawana, our community health worker supervisor, who would then triage that referral to determine which of the community health workers would be best suited to support Danielle at that time. This is just a visual of what that screening looks like in my chart. So this is from the patient perspective. So when you receive that screening in your my chart, either app or online or whatever, you're able to complete that screening, those screening questions, and then that information is sent back to your clinical care team. So this, after you fill out those screening questions, this is just a visual of what the actual social determinants of health wheel looks like. So when you have a high-risk need identified, that shows in red. When it's medium or rising risk, that shows in yellow, and low risk is in green. And then I'll just point out also on this screen where you have the finding community resources here at the bottom, that hyperlink. So if you click that hyperlink, it takes you to the social determinants of health resources. So those 211 resources that I referenced earlier, those are the resources that this hyperlink will take you to, and it's all of the resources that United Way of Dane County has in their resource directory. So we're able to literally pull all of those and add them to a patient's after visit summary. So then the team would link Danielle to the appropriate resources. So for instance, if it were a housing resource and she needed some help, maybe it's a core application that she needs to fill out for rental assistance, the team would be extremely hands-on and support her in filling out that application, as well as identifying if there were also a food security concern. They could help her also fill out application for food services. They could deliver food to her front door. And so it's a very hands-on process that takes place at this point, that the community health worker team is tasked with really just making sure that folks know how to navigate internally in our systems, as well as those community resources as well. These are the community-based organizational partners that we have that bidirectional communication with. So we're able to, like I said, in real time, send these referrals over to these organizations, have them verify if they're able to provide supports for those patients, and then also have ongoing communication to go back and forth to really stay in contact as care team members, but also if we find out new information on our end about a patient's needs, we can help the patient communicate that to the community-based organizations as well. And then the next few slides are just some visuals of what it looks like in Epic. So this is the actual community health worker added in that actual care team in Epic, and you see that down here in red. So as the same as you would have the PCP or the OB provider listed in that care team, the community health worker is in there as well. And then just the documentation component. So because the community health workers are official care team members, they do document all of their patient outreach in Epic as well. And so if you go under chart review, you can see all of the ongoing documentation that the community health worker team is documenting. So they have anything from all of the different resources that they have helped connect patients to that then other care team members can go in and see these updates. And so, for instance, if during an OB appointment, the OB finds out that the patient has a housing concern and they are wondering, whether or not that need has been able to be met by someone on our team, they could go in under these patient outreach notes and see what the update status is as far as meeting that patient's needs. And this is just more of where to see social determinant of information in the actual patient record. So the care coordination notes would be where you could see the most up-to-date information on the status of the program of the patient in the program, as well as the care team and the SDOH wheel populated as well. And I will pass it to Jawana.
Good afternoon. As Adrian, Ariel have discussed, I feel like this program has been in the works for many years. So now this is kind of us actually putting all of their hard work to action. So this is our current community health worker team. We are missing one member who just started here in January named Kim. So we do have 7 current community health workers with me as the supervisor. Next slide, please. So this shows the doula partners that we're connected with through the Foundation for Black Women's Wellness. Each intake, we do ask the patient if they're interested in a doula and also explaining the benefits of a doula, regardless of what stage they are in their pregnancy, because we do know having that additional support in the labor and delivery room, someone that can advocate for your birthing plan, makes a huge difference, because we want the mom just to focus on delivering a healthy baby and not have to argue with medical staff about what her desires and needs are. Next slide, please. And then this is just some of the data of the referrals that we received to date. So to date, we've received 394 referrals total. And then this kind of breaks down how many referrals we receive per health partner. Next slide, please. And then this just kind of shows more of a breakdown of the referrals that we receive per health partner. And then this slide shows the status of the patients we support. So to date, we have about 174 active patients, 74 declined, 51 closed, and 20 enrolling. The decline number is a variety of things. It could be patients who we haven't been able to reach once they were referred, or people who were active and then decided to no longer participate in the program. And then unfortunately, we've had some patients suffer some miscarriages and some infant loss, so those would be included in those numbers as well. Next slide, please. And this is just kind of a breakdown of how many patients have indicated that these are one of their social determinant of health needs. And as you can see, financial resource strain floats to the top, but I feel like that kind of builds into the housing stability concern, the food insecurity, because if you don't have finances for housing and for food, it ends up being like a more of a major problem. And then I would say stress is also one of the very top ones, because with the financial resource strain, it does cause a lot of stress for our patients. Next slide, please. So the 16 members handle a caseload of about 30 to 40 patients each. I personally handle a caseload of about 25 patients to support the team. I also, when I triage the referrals, I kind of grab the patients that may seem to need a little bit more hand-holding, or if they're extremely young, because we do have some pretty young patients. So I try to take those cases on versus dispersing it to the team, because they may need a little bit more care. And then we do reach out to patients within 48 to 72 hours after the referral is received. So as soon as it's received, I assign it to the community health worker, and then they reach out fairly quickly. And then we are actively recruiting for our last position. So send over any good folks that you may know. All righty, and then this is another brief summary of the referrals we received in 2022. We've had about 392 program referrals, roughly 168 active patients at the end of 2022. We had 110 doula referrals to the Foundation for Black Women's Wellness for doula support. We've had about 65 births to the program since the program started, and about 56% of those have been supported by a doula. The program acceptance rate is about 55%, and we've connected patients to over 1,260 community resources. Slide, please.
And then I will wrap us up. So I just, I feel like depending on what audience you're presenting to, they might be really interested in the evaluation that's taking place. And so I just wanted to share a little bit on the multi-level evaluation that we have planned out. So we are working with 2 evaluators from UW Population Health Institute. So we're working with Dr. Sarah Lindberg and Dr. Tiffany Green. The study design itself is a mixed method observational descriptive study of ConnectRx participant. There is no comparison group and no repeated measurements. But from the systems evaluation components, so we are utilizing some actor mapping, journey mapping, as well as some cross-case analysis. As you can imagine, it's a pretty complex operation that's taking place right now. So lots of data use agreements that need to be secured in order for us to be able to truly measure and truly just test out, like just know what the outcomes truly are. And so we have, like as Adrian said, we have dashboards set up that we're able to track sort of the process information. So we know how many folks have been referred in the program. We know how many, births have taken place to program participants in the program itself. But to really get that outcome information, we're going to have this very intricate evaluation taking place. And so we actually earlier today just got our evaluation plan approved by our executive team. So there will be certainly more to come. But just another, just back to what I was saying earlier about continuing to center Black folks in this space, that's going to be a really key component, just some additional interviews and surveys that we'll need to really be able to measure what the patient experience is like in the program, what the community health worker experience is like in the healthcare system itself and working with patients in this space. So certainly much more to come for this component, but just wanted to share a little bit with you all today. Thank you.